Hello, and welcome to Mullen's Benefits Companion, a podcast that helps employers navigate the complex legal challenges of managing their employee benefit plans. I'm your host, Brydon DeWitt, and today I'll be joined by Claire Pollock, a paralegal in our employee benefits practice group here at Mullen. How are you doing today, Claire?
Great, thanks, Brydon. How are you?
Doing well,
Good.
Trying to avoid the storms that are coming in
Sure.
today when we're recording this podcast. I thought today, in this episode, we would discuss some proposed regulations that would make it easier for employers to help employees pay for health insurance premiums.
Well, this is always a great topic. Employers can certainly use the help within health insurance premiums continuing to climb. I actually saw a report that in 2018, the average annual premium for an employer-provided family coverage increased 5% to over $19,000. It's especially difficult for small employees to provide health insurance to their employees.
That's true. I mean, health insurance premiums are increasing every year. Over the last 10 years after the Affordable Care Act was enacted, we've seen steady increases in the cost of health insurance premiums, and a lot of that has to do with a lot of the mandated coverage under the Affordable Care Act. And small employers in particular have a difficult time providing a group health plan for their employees. Before the Affordable Care Act, a lot of smaller employers would simply reimburse the cost of individual policies that employees would purchase. So an employee would go out in the individual market and find a health insurance policy that they like, and then they would present the premium bill to their employer, and the employers would cover all or a portion of the health insurance premium.
So what changed with that process with the Affordable Care Act?
Well, the Affordable Care Act imposed, for the first time on a federal level, mandated benefits for health insurance. So health insurance policies could no longer have annual limits or lifetime limits. They had to cover preventive care on a first dollar basis. And so all these requirements applied to group health plans. And then in 2013, the IRS came out with some guidance where the IRS determined that these arrangements where employers were simply reimbursing health insurance premiums, through perhaps a health reimbursement arrangement or HRA, were in fact group health plans subject to the Affordable Care Act. So if all the employer is doing is reimbursing the monthly health insurance premiums for individual policies, that arrangement necessarily violated the requirements that there are no annual limits to coverage or lifetime limits or coverage for preventive services, because all these arrangements are doing were purchasing health insurance premiums for employees. And so that created a problem for a lot of small employers who could no longer just reimburse the cost of individual policies, and made a lot of these health reimbursement arrangements non-compliant with the Affordable Care Act.
So does that mean that employer can no longer offer a health reimbursement arrangement?
Well, not exactly. So under guidance that was issued in 2013, the IRS allowed HRAs, or health reimbursement arrangements, that were integrated with the group health plan. And there are some complex rules in that guidance, but the gist of it is that as long as an employer offered a group health plan that complies with the Affordable Care Act, so they go out to Anthem or United Healthcare and they purchase a group policy for their employees, the employer could then offer a health reimbursement arrangement to cover additional expenses, co-pays, or deductibles if the HRA was integrated with the group health plan. And what that basically means is that the only employees eligible for the health reimbursement arrangement are employees who are eligible for the group health plan. So as long as the employee had access to a group health plan, a standard group health plan that complies with the Affordable Care Act, the employee could also be enrolled in a health reimbursement arrangement. But the proposed regulations that we received just in the last few months would expand this concept of integration to individual policies. So it would kind of take us back to where we were before the 2013 guidance from the IRS. Under the proposed regs, an employer could integrate its HRA with individual policies that either the employee purchases from the individual market or from an Affordable Care Act marketplace or exchange. And so as long as the employee has an individual policy, the employee can be offered the health reimbursement arrangement that would cover the premiums under the individual market policy. Now, the employee would have to substantiate that they actually were enrolled in the policy.
So in other words, an employee goes out to the marketplace, purchases his or her insurance, and then the employer reimburses that amount to the employee up to the amount of the premium.
Right, through the health reimbursement arrangement.
It seems fairly simple.
Right. And before these proposed regulations, though, that would be illegal. So this is, once these regulations go into effect, it's going to greatly expand the ability of especially smaller employers to have health reimbursement arrangements that cover individual insurance premiums. Interestingly, and this is just my own view of this, the regulations have a rule that I think is designed to prevent dumping, prevent encouraging employees to not enroll in a group health plan of the employer and instead go to the exchange. So under the proposed regulations, an employer can offer either the group health plan to employees or the HRA, individual insurance premium reimbursement arrangement, but not both. So an employee cannot be eligible to enroll in the group health plan or choose to not enroll in the group health plan and enroll in the health reimbursement arrangement and go to the exchange. And so each classification of employees, full-time or part-time or seasonal, or employees who are under age 25, or employees who haven't reached the group health plan's waiting period, there are certain classifications of employees in the regulations. Each classification has to be offered either one or the other, but not both. And I think my view is that the reason for this is to avoid an employer from saying to employees who have high risk health issues or have high claims, a history of really high claims, or the employer knows the employee has monthly health expenses that are really high, that are driving up their insurance premiums during renewal, from going to that employee and saying, we'd really rather, instead of you enroll in our group health plan, that you go to the exchange and have the insurance through the exchange cover these claims, and we'll provide you cash through an HRA to help offset those premiums. So I think that's the reason for that rule, but just keep in mind, if an employer is going to adopt this arrangement, that you can't offer both. So if you have a group health plan, you really can't offer the HRA that would reimburse individual insurance premiums to the same group of employees.
When do you think the rules would be effective? They're in proposed form right now?
That's right, and that's a good point, is these rules are not currently in effect, so employers shouldn't rush out and start adopting health reimbursement arrangements to reimburse individual insurance premiums. The regulations are in proposed form, and these rules will not be in effect until they become finalized, and that probably will not happen before 2020. But hopefully, pretty soon in 2020, we'll have final regulations. And so there's an opportunity now for comments that are being received, and the regulations could change. These proposed regs and rules could change before they're finalized, but once they are, it's likely that in the near future we're going to have this option, and it really will help mid-sized to smaller employers provide health insurance to their employees.
Yeah, it really does seem like a simplification on the process and making it desirable for employees who are not getting any coverage to go out to the marketplace and get insurance and get some help from their employer.
Right, and really from a public policy standpoint, it's going to make it easier for more people to enroll in health coverage, make it more affordable for more people, especially with employees employed by small businesses, to be enrolled in coverage.
Absolutely.
So that'll wrap up our discussion of the proposed health reimbursement arrangement regulations. I'd like to thank Claire for joining me on the Benefits Companion. If you have any questions for future episodes, please contact me at bdewitt@williamsmullen.com. You can also visit our employee benefits practice webpage at www.williamsmullen.com/employee benefits. There you can find out more about our team, as well as past episodes of this podcast and legal alerts. Be sure to subscribe to this podcast to be notified when our next episode posts. Thank you for listening.
Thank you.